Moving on to item 19. Oh, I have remote speakers. One moment. Sandra Muller. Sandra, are you there?
Hello, can you hear me?
Oh, yes, please.
Hi, sorry. Okay, hi, this is Sandra Muller. I'm no longer a resident of Austin, but I lived there for 13 years, and I was a volunteer for both APA and AAC, and I was there when this original 2019 resolution was added. And I fully support this amendment to the city code that puts the decisions back into the hands of AAC's veterinarians. I think it's really important, and I want to thank the sponsors for putting it forward. So for years now, AAC has been above capacity, often with closed intake, and the PRC has backlogged appointments for owner surrenders. So it makes no sense to add to Austin's animal population. But APA says they'll take all the puppies and kittens. Why? Because they're easy to adopt, they make for good marketing, and they sell for $250 a pop, or pup, as it were. So it sounds a bit like for-profit breeding to me. But as you know, the population that actually needs saving are medium to large dogs that have been languishing for years and costing the taxpayers lots of money. So APA has asked their social media friends to oppose this item. They're going to get a lot of calls. But in an interesting turn of events, people are supporting this resolution. The county is currently schooling Dr. Jefferson on spay aborts and her supposed overpopulation myth. So thank you for this resolution, and let's get the animal population under control. And I would just like to remind the people there, I know you've all been there all day, I want to remind you that adopting a senior or adult animal means you still get all the love, but you will know the breed, the weight, the temperament, the skills, and your home will not be chewed up or peed on. And thank you all for your time.
Paige Nilsson.
Hello, Austin City Council. My name is Paige Nilsson. I'm a resident of District 4, and I'm a practicing veterinarian. Prior to vet school, I did neurophysiology research at UCLA for 3 years. I am also the newly elected chair of the Animal Advisory Commission, but I am not speaking in that role today. I am speaking as a practicing veterinary professional and passionate animal advocate in support of Agenda Item 19. Yesterday, APA put out a video in opposition to Item 19. My statements to claim that, quote, this is not a procedure. Her opinion and the graphic procedures she described are not in line with the current science and recommendations for pregnant spays. Spaying pregnant cats and dogs is a routine procedure that is humane when done according to current Association of Shelter Veterinarian guidelines. And there is no fetal suffering after the procedure. In my comments today, I'm referring specifically to cat and dog fetuses, and all of my statements are supported in the 2012 JAVMA review article that I emailed to Council this morning. During a spay of a pregnant cat or dog, the fetuses have the same or higher concentrations of anesthetic drugs as the rest of the animal that is undergoing surgery. Additionally, after the uterus is removed, fetuses inside of that uterus cannot get rid of the anesthetic drugs if the uterus is kept closed. Therefore, shortly after spay, the fetuses die on their own from a lack of circulation while they are anesthetized. Additionally, as detailed in the JAVMA article, we have EEGs that show there is zero possibility of fetal brains in a low oxygen state. Because there is no consciousness in these fetuses, in addition to the fetuses being anesthetized, there is no fetal suffering. I encourage you all to let science, expertise, and logic shape our city's policies and vote yes on 19. Thank you for your time.
Catherine Chambly.
Good afternoon, council members, mayor. My name is Catherine Chambly, and I'm a resident of District 7. Thank you for allowing me the opportunity to speak today. I am calling in to support item 19, a resolution giving spay abort decision-making back to the veterinarians at AAC and directing the removal of the current ordinance requirement that rescues be given 48 hours to pull visibly pregnant animals in order to deliver their litters. Austin is currently in a stray and unwanted animal crisis. This resolution would cut down drastically on the number of animals entering the shelter rescue pipeline in Austin and in no way impact the city's no-kill status. No-kill involves the live release rate of living animals, not the required birthing of unborn fetuses. As it currently stands, Austin law is effectively anti-abortion for pets and results in an unnecessary mass production of baby animals for purposes of sale, in large part by Austin Pets Alive. It is mind-boggling to me, in my opinion, irresponsible of APA, a nationally known rescue, to be so adamantly determined to continue this kitten puppy supply line. And quite frankly, it appears APA is out of sync with virtually every other animal rescue group in this regard. Indeed, the vast majority of public comment on APA's stance find it shocking for a large rescue and profoundly irresponsible. I am asking City Council to listen to voices of reason and vote in favor of Austin's living animals in favor of this resolution. Thank you for your time.
Heather Myers.
Good afternoon, Mayor, Mayor Pro Tem, and council members. My name is Heather Myers, and I am a volunteer at Austin Animal Center, an attorney, and an animal advocate in the greater Austin area. While I would typically be here to zealously support item 19, the primary impact of which would permit Austin Animal Center to perform spay-abort surgeries without notice to rescue partners, I am unable to do so in light of the proposed cuts to AAC's specialty and emergency veterinary services in the city budget. It's true those services are not the same ones used for routine or complex spay-abort surgeries, but they are still critical to AAC's ability to treat sick and injured animals and respond to emergencies. The current veterinary team is already struggling to meet existing needs. In fact, there's currently a backlog of spay-neuter surgeries for dogs that are not pregnant. So cutting specialty and emergency care services while increasing surgical interventions under item 19 will stretch an already under-resourced system to the breaking point. Even if additional spay-abort services could be provided with current resources, the loss of specialty and emergency care will mean other animals in kennels or on the streets will wait longer, suffer more, and in many cases die unnecessarily. Preventing that harm depends on a fully functional, well-resourced veterinary department across all service areas. If council passes item 19, you must also fully protect funding for emergency and specialty veterinary care in the proposed budget. Councilmember Lane's Amendment 2, which reallocates $100,000 of the more than $500,000 in cuts, is a start, but it does not go far enough. Expanding one part of the veterinary workload while cutting the funding for another will not balance out, but it will harm more animals and further erode Austin's no-kill commitment. Thank you so much.
David Page. David, are you there?
Hello? Yeah, I'm sorry, I have to turn off mute. Good afternoon, Mayor and Council. My name is David Page. I'm an Austin District 6 resident and volunteer with large dogs at AAC, then APA for about 10 years. I read the draft of Resolution 19 on the city website and was puzzled as to what problem this resolution attempts to solve. After some investigation, I believe the intent of the resolution is to remove a requirement that AAC please pregnant dogs and cats to rescues before spaying the animal. And I think from listening to the discussion so far, that's the case. I have concerns about how the resolution is being presented. I feel like the resolution is disingenuously worded and could have been much clearer about its intent. There is no reference to current city code or policy in the resolution. The resolution addressing no fiscal impact was given in the resolution, but I suspect it's infinitesimal in the scope of the budget challenges our city faces. The resolution is, in fact, a animal welfare policy issue and should be brought up for discussion in that context, and stakeholders should have an opportunity to weigh in on a policy change instead of trying to slip it in via the budget. I'm totally in favor of spay and neuter, for example, adopting an ordinance similar to Waco's mandatory spay and neuter and microchip ordinance, and increased funding of free spay and neuter clinics in high-need areas of Austin. At the same time, I have some misgivings, just personal feelings about spaying dogs and cats that are close to giving birth, as possibly due to my ignorance. If there's a net community benefit to removing the requirement to flee these animals close to birth of rescues, then the proponents of the resolution should make their case explicitly. So given the above, I urge y'all to vote no on Amendment 9 and move the discussion of the issue to the Animal Advisory Commission or other appropriate venue. Thank you.
That's all the remote speakers for 19, so I will switch to in-person speakers. Walter Moreau. Sophia Barbato, Sharon Blythe, Shelley Lieb, Ben Suddaby,
Good afternoon, Mayor and Council. My name is Shelley Liebum. I misspelled my name on the form. Sorry about that. I'm a resident of District 4 and a volunteer at Austin Animal Center. Thanks for letting me speak today. I'm speaking in support of item 19, a resolution giving spay-abort decision-making back to the veterinarians at AAC and directing the removal of current ordinance requirements that rescues be given 48 hours to pull visibly pregnant animals in order to deliver their litters. Austin is currently in an animal crisis. Too many stray and unwanted animals. Any given day at the shelter, we're housing animals in crates. Intake is closed. Animals are being turned away back to the streets. Dogs are living in shelter kennels for a year or longer due to the lack of fosters or adopters. I've been volunteering there for over 5 years, and this has been the status quo the entire time I've volunteered. With this backdrop, it is unfathomable to me that this city has in ordinance a requirement that the shelter provide rescues a 48-hour notice in which to pull visibly pregnant animals before the city vet staff can perform spay abortion procedures. For a concrete example of the effects, according to Austin Pets Alive records, during the first 3 months of this year, they pulled a total of 24 pregnant or nursing dogs from AAC as a result of this ordinance. At an average of 5 to 7 puppies per litter, extrapolating out for the year, that number is about 480 to 672 additional shelter puppies entering the city's systems this year. APA's argument that it is no longer the city's burden nor a drain on city resources once their organization pulls these maternity dogs is, in my opinion, a logical fallacy. APA is an Austin-based rescue with largely Austin-based fosters and Austin-based adopters, meaning that even though APA may take the burden of all these additional animals on paper and then charge fees when they get adopted out, these animals are still adding to the pet population in the city, which has a finite number of adopters and fosters. I'm asking you to end the city's current status as in my opinion, de facto backyard breeder of shelter pets and vote in favor of this resolution. Thank you.
Pat Vostreyes, Julie Oliver, Craig Nazer, Susie Chase, and Rochelle Vickery.
If your name's been called, feel free to come forward and take a seat, and we'll just go in order. Ms. Valtrez, please begin.
Okay, thank you, Mayor and Mayor Pro Tem and City Council members. My name is Pat Valstreyes, and I live in District 3. I support item 19. Thank you, Councilmember Lane, for this item and also for Amendment 2. I really appreciate all you're doing in your first year at council. Thank you also, Councilmembers Siegel, Vela, Kadri, and Duchin. I appreciate that you are co-sponsoring this item. I hope it passes. Our community needs this, and we support you in passing this. Thank you. Pet overpopulation is not a myth. It is real. It is the reason our shelter is full. It is the reason we have closed intake. It is the reason that people who find a dog or cat are being told, you have to take responsibility for them. You have to pay for them to find their homes, to get them spayed or neutered, to get them vaccinated and microchipped. This is wrong. We have closed intake, and we need to change that by preventing unnecessary births. We need to take care of the animals that are already born, that are already living at the shelter for months and months and possibly even years. Our community shouldn't have this. We support a good animal shelter, and we have come out here and we have spoken in favor of it, and you know we care, and you know we want spay-neuter, we want a good shelter, and the city audit commended the shelter veterinarians as the one program that was doing a good job at the shelter. Those veterinarians at the shelter should be trusted to make these decisions, and they should be allowed to spay and neuter. So thank you for what you're doing for Austin dogs and cats. I know this isn't your only problem. I know you have much, much bigger things on your agenda, but I appreciate this, and especially Councilmember Lane. Thank you.
My name is Rochelle Vickery. I'm coming to you at a different perspective. I've been a trapper for Travis County and Austin for almost 30 years. I don't like to trap female cats that are pregnant, but that's what happens. They are very frightened. That queen knows where her safe place is. But mine was going to the Humane Society, and the city was paying for it. And you can imagine if you multiply 6,500 cats by 4, that's how many kittens I stopped from being born. And when people take cats into the city, if it's pregnant, it goes to Austin Pets Alive. I want you to visualize a cat thrown in a cage, 4 by 4, 3 by 3. She doesn't know where she's at. She's well taken care of. The Austin Pets Alive does take good care of her. But she has to have her babies, and in turn, they take her babies, they fix her, and they put her in a barn thing. That isn't her home. She doesn't know where that is, and that's not her safe place. So let's fix her, put her back where she came from, and that family feeds her or whatever. She knows where her food is. I ask you to please let the vets take care of our animals. And it is a cash cow for Austin Pets Alive. The puppies, you heard what they was charging for puppies, and it is for cats. That's how they make their money. That's why they want all the puppies and kittens. Thank you. I just hope you just pass it, please.
Whoever wants to go next.
Thank you. Dear Mayor, Watson Council, I'm Julie Oliver. I'm a resident of D9. I wish my councilman was here right now, but I'm a large dog volunteer at Austin Animal Center and want to share my concerns about agenda item 19, which would reverse the city's policy requiring rescue notification before performing spay aborts on visibly pregnant animals. It was reaffirmed in 2022 by the Austin Animal Advisory Commission. I understand and appreciate the complexity of shelter management, budgeting, and the policy at issue. But based on my experience at AAC, I believe this change is not well timed, particularly when proposed budget already cuts emergency and surgical veterinary funding, and when our shelter's veterinary team is already stretched beyond their capacity. This might be a different conversation if the shelter were fully funded and staffed to meet the medical needs of the animals in its care currently. I've personally been asking a month that council restore veterinary funding and perhaps even add to it. This feels really misaligned right now with the cuts and adding more surgical requirements to the shelter. As a volunteer, I see firsthand some of the bad outcomes. I'll give you an example. Princess Peach was not pled to APA. She was a visibly pregnant dog. We submitted a lot of pink slips for her. After her surgery, she was put into her kennel immediately, bleeding from her surgical site. Her gums were pale. She was not doing well. They put her back in veterinary services for over a month. That cost the shelter a lot of staff time to take care of her. Another dog, just a routine surgery. He swallowed a squeaker toy. His name was Licorice. For 8 days, he was vomiting. 6 pink slips went in, asking for somebody to look at him. Vet staff couldn't look at him. They couldn't perform the surgery on a dog in their care already. And he was pled to APA. Thank you, APA, for taking him and saving his life. It's just not the right timing right now, so please reconsider this.
Councilmember Codring.
Yeah, I'm just going to make a quick comment. I've been walking off the dais at times. My grandfather died not even 12 hours ago. I was on the phone with him and my mother as he took his last breath. I am trying to be here as much as I can, but if I'm walking off the dais, it's not because I'm having fun. It's because I'm talking to my mom as she's finding out where to bury him. So I just want to make that known.
Thank you, Councilmember. Yes, ma'am. You go next, and then Mr. Naser.
Thank you. Good afternoon, Mayor, Mayor Pro Tem, and council members. I'm Susie Chase, District 10 constituent, former council staff member, and for over 4 years, I've been working at Austin Pets Alive. I spoke with several of your staff members yesterday after finding out on Monday evening that item 19 was posted on the budget agenda with 0 community stakeholder engagement. Austin Pets Alive, the nonprofit shelter partner that accepts 100% of the animals that Austin Animal Center asks us to take that are pregnant, was not notified by any of your offices that a change was proposed to our operations as your largest shelter partner. So for the sponsor and co-sponsors that are up here on the dais, it was my understanding that leadership at the City of Austin shows a culture of transparency and community engagement built on the Bleecker training of informed consent, but this is not the case with this item. Item 19 as written will not reduce taxpayer funding. Item 19 as written will not minimize overcrowding at the city shelter. And item 19 as written is not a pro-choice issue, as one of your staff members alluded to me in a meeting yesterday. On behalf of Austin Pets Alive, I'm going to be very transparent. We have had a really good working relationship with the interim chief and with ACM Carbajal, and we really want to have a good relationship with all of you. All of your offices have been invited to tour with me and Dr. Ellen Jefferson, and all of your offices have received a proposal from Dr. Jefferson today that should be an amendment to item 19. My ask for you is that you will please vote no to item 19 or else consider this a friendly amendment. And thank you so much for the time. Please let me know if you have any questions.
Thank you very much. Mr. Nazer?
My name is Craig Nazer. I am representing myself. I was a past member of the Austin Animal Advisory Commission for 8 years, and I was the chair for the last 2 of those years. I joined the commission at the beginning of No Kill. I had not been a part of that movement, so I learned about No Kill by watching the then Chief Animal Officer, Tawny Hammond, successfully show the entire country what No Kill was and how it could work. I think No Kill can work, but it must have the right leadership and it must be allowed to evolve. Without that, it will fail. No Kill works by stopping the killing of animals for their own good or for the city's lack of resources. Item 19 is not in alignment with these goals. The way No Kill is successful is that it greatly increases involvement of partner nonprofit organizations and individual volunteers because they have little to object to in what they may see as the unethical killing of animals. I believe the reason the shelter is in its current distressed state is due to the erosion of trust between the shelter and our many essential partner organizations and volunteers. I believe this is largely due to poor past leadership at the shelter, a leadership that did not understand that what No Kill required to succeed. The Animal Advisory Commission, through a recommendation, made this as clear as we possibly could 3 years ago. Approving item 19 will not improve this situation. New budget cuts will prevent injured animals from getting emergency life-saving care, yet pay veterinarians to cut late pregnancy fetuses from healthy mothers when other options are possible. To me, this makes no sense, and I cannot support it. I hope you don't either. Thank you.
We had a remote speaker call in for 19. It's Beverly Luna.
Hi, this is Beverly Luna again with Austin Lost and Found Pets. I'm first concerned this item isn't a budget item, and so it makes the title of the meeting misleading, and it seems inconsistent with the intent of the Open Meetings Act. Austin Lost and Found Pets gets between 12,000 and 1,800 posts for lost and found pets each month, so I'm keenly aware of the dogs that get into the Austin Animal Center and those that do not. The Austin Animal Center regularly refuses to allow pregnant dogs into the shelter under their emergency exceptions until the dog is about to give birth. So what they're proposing here is that they perform abortions on dogs that are probably within a week of giving birth. Are they planning to suffocate the pup? Are they planning to drown them? To me, this is beyond cruel, particularly considering Austin Pets Alive will take them. AAC is currently making appointments for dogs today to get into the shelter, but they're looking at dates in October. And dogs are generally pregnant for about 57 days. This late-term abortion, it's just shocking that y'all would even consider this and that Ms. Nielsen hasn't made you aware of this. But I can tell you it is extremely rare for a pregnant dog to get in at any time before a week or so before she's about to pop. Anyway, I'm just appalled by this. I don't even know what to say. I spoke to a very active dog volunteer this morning. She said she never sees pregnant dogs at the shelter. They all go to APA because they're all about to have their babies. And no, this doesn't increase the number of dogs that go to the shelter because APA always takes back dogs that are found, that the owner doesn't want them back. They always take back their dogs. Anyway, this should really be considered by the Animal Advisory Commission, where a representative, two representatives of the county are on that. You're sort of leaving the county out of this by letting Paige Nielsen and others circumvent the Animal Advisory Commission and go directly to the city council.
Thank you.
Thank you. Time has expired. Going back to in person for item 19, Julia Crenshaw Smith, Alexis Bardinsky, Derek Ernst, and then Ellen Jefferson. Ellen, are you here? You have time donated by James Hereford. James, are you here? And Maggie Lynch. Okay, 6 minutes then. Thank you.
Hi. My name is Julia Crenshaw Smith, and I am in District 9, and my condolences, Mr. Kadri, for your loss. I am here representing myself, and I am a longtime advocate for the humane treatment of animals. I believe this resolution is written in a deceptively benign manner. On the surface, it seems reasonable to allow AAC vets to make spay-neuter decisions, but in reality, it is making a dramatic change to our approach to animal life and misleading Austin residents in the process. To my knowledge, there currently are no limitations on AAC's ability to neuter male animals or spay female animals who are not visibly pregnant. So this is really just about empowering AAC to spay visibly pregnant females, a practice that is completely at odds with Austin's commitment to being a no-kill city. Not here to speak on the ethics of spaying pregnant animals. That is a nuanced topic, and people have very strong opinions about it. But I do want to speak about how this is going to change how we approach animal welfare in Austin. Spaying is a relatively straightforward procedure that removes the reproductive organs from an animal so they can no longer reproduce. However, if that animal is pregnant at the time of the procedure, killing any fetuses is a separate act, independent from the spaying procedure. If you take specific action to kill a viable fetus, then it was a living puppy or kitten, and its death cannot be considered a miscarriage or a spontaneous abortion. Thus, each intentional death will count as a kill, which will quickly lead Austin to fall below its mandated 95% live release rate. Any other way of looking at this is disingenuous. And so if AAC inaccurately codes these deaths as miscarriages or fetal deaths to avoid counting them in the overall kill rate, that destroys the authenticity of our no-kill status. And we are leaders in the world, in the country. The way we approach no-kill matters. It ripples out. So I'm not sure, like others, why this is in a budget meeting, but clearly I think this is a significant enough change that we need to do this the right way with public hearings, public input, deep research, and a longer-term view than a budget line item. Thank you.
Thank you. Yes, sir. Why don't you go ahead and...
Thank you for letting me be here today. My name is Derek Ernst, and I am I've been with APA for over 6 years now. I'm going to speak for some of the adopters that actually have contacted us. We have had over 200 postcards from adopters in the past 24 hours, all of them thanking you for the ordinance that exists and require government transparency about vulnerable pets in need. They're thanking you because they wouldn't have their pets they love so much without it. They are imploring you to keep this ordinance as is. Here is just 2 comments. All of my animals were born in foster before we adopted them. We are so thankful for the fosters that cared for the pregnant mothers and gave them a safe place to have their babies. Please do not euthanize the mothers or their litters. Austin prides itself on being a no-kill city. Keep the litters, visible pregnant dogs and cats goes against what Austin has stood for. Here's another one that said, over my time fostering, I have cared for the sweetest kittens born in pregnant felines who have given the chance to deliver and nurse their young. These kittens have gone on to enhance even transform their lives and families here in Austin. I have seen firsthand how the gift of the life ripples outward, not just for animals, but for the people who love them. And on a personal note, I fostered and recently adopted myself a sweet and beautiful Pit Terrier mix, Lexi May, who came from APA from AAC. Lexi May gave birth on June 1st to 11, yes, 11 puppies. As of today, I'm happy to say that 6 of Lexi May's puppies have been adopted and 5 are in foster care about to be adopted. I have had the pleasure of meeting 2 of the adopters, and I saw the joy it brings to families to adopt these puppies. This ordinance made that happen. Thank you for your time.
Thank you. Please.
Thank you so much for listening to this topic. I'm sorry it's coming at such a busy time for you. Our shelter is represented by District 9. I echo the condolences. I think you know a little bit about me, but I've served on the Animal Advisory Commission. I am the founder of Amansa Pet Spay and Neuter Clinic and president and CEO of Austin Pets Alive. The last 36 hours, we've been scrambling to just try to figure out what this is about because we didn't get any notice. We weren't brought in as a stakeholder in any way, shape, or form and found out by mistake from a volunteer about it. And so it's been really hard to figure out what is behind it, what's driving it, and where is this going. It appears that it has three intentions. One is to save about $300,000 that is a perceived, maybe a real cost. I haven't been able to see any backup for this, but about $300,000 that are potentially spent on animals that are living in the shelter that have given birth in the shelter. My understanding was we took all those animals. So if there are some that we haven't, then I want to address that. And the intention, I think, is to then turn that $300,000 into money that goes back into the overnight emergency fund, which is something our community really needs. So I can support that. I understand if that's the intention. I understand where that's coming from and think it's well founded. The other intention is to move pets out of AAC faster, creating room for intake, and decreasing bureaucracy are the three things that I think this is trying to accomplish. As it's written, there's some unintended consequences, though. One is that it's causing the deaths of animals that are literally about to be born. And two is that it erodes the partnership trust. This is something that we care very deeply about, and I wish that puppies and kittens made enough money to pay their own bills, but that is absolutely not one of the reasons that we're taking puppies and kittens. And it removes the level of transparency and safety net that our organizations have worked together on for the last 15 years. It also drives up the costs of AAC because the animals that we're currently taking, we're responsible for their spays and neuters. We're responsible for their vaccines, their heartworm treatment, their adoptions, everything up until the point where they go to a new home. If that's taken away and the medical need for us to pull them is gone, then they are still at AAC taking up a kennel space and being paid for by taxpayer money. So I've sent over an alternative to you that has solutions. One is that we can push all the pregnant animals. One of the things I would recommend is that we make it so that 100% come to us. And that would take down your cost of $300,000. That immediately puts the money back into the bank to be able to put towards this emergency fund. It prevents the unnecessary deaths, and it increases the speed and volume that are sent to us, which I know is something that the Austin Animal Center wants. And I will tell you that none of the babies are considered intake as part of our contract. It's always extra. That is not counted in the 17% that we're already taking. So that results in more kennels being free because you've got those animals out of there. It results in higher intake because you have kennels free. It decreases how much money you're spending, and it keeps trust between partners. And so I'm hopeful that you've read that and that we have a chance to discuss it and that you'll vote no on this today so that there is a chance to move that forward or some version of it. The second thing that I want to address is that the process itself has some misinformation that I think is worth trying to clarify because rescue access is critical to no-kill as a foundation. It's about transparency. I know a lot of people have used the word transparency up in the speaker's piece here today. And I want to clarify that the ordinance as it's written now does not take away any veterinary discretion. The veterinarian has full discretion, full medical abilities. They can make decisions. Doesn't even matter where they went to school or how much they know about a topic. There's no guidance given to them about the decision. The only thing it does is cause a pause. So it causes the shelter to take a second to notify rescue groups and say, does anybody want this animal before we euthanize it? That's it. That's it. There's no regulation put on what they do with the animal, how they do the surgery, if they spay a pregnant animal. It is just giving organizations a chance to say, I'll take it. And we take a lot of those. We took 200 in June, and we took, I think, over 350 in July. So the process itself, the pet comes in, somebody notices that it's very pregnant. It does not take a veterinary degree to see if an animal is very pregnant. They pause, they send out the notification, and if they're not pulled, they are spayed. The city has the discretion to spay those animals if they're not pulled. I think that's really important because I think this is getting conflated with medical decision making, and that is absolutely not the case. One addition that we can make is that the ordinance right now gives 48 hours for that response. One addition that we would make on the spot is we'll take them same day. Like we believe in this, we're committed to this, we will make this easy and possible for the city of Austin. And I'm not planning to address a lot of the things that came up that were sort of accusations in earlier comments, but if there's any questions, especially about the data of adopters versus animals that are entering shelters, I'd love to discuss that. I'd like to think that we live in a data-driven decision-making community, and I just really appreciate you.
Thank you.
Okay, thank you.
On to item 20.